Hi, this is Dr. Carin Purtle. I'm a chiropractor in Peoria, Illinois. You're about to listen to an interview I did as a guest speaker on the popular internet radio show Health News, which airs weekly out of the Northeast United States. The interview will give you a general overview of the value of a chiropractic treatment program that's customized for you. What it will not do is allow me to answer your questions about your health goals and what issues you're currently having that I can help you with. After working with hundreds of people over many years, I know that nothing is more important than helping you. I know you want to be healthier next year than you are this year, and even healthier 5 years from now. I also know finding the answers for the problems you have right now are the most important, and I want to help you do that, or at least point you in the right direction. The best way to do that is for me to offer you a complimentary consultation with me either over the phone or in my office. There's no obligation and it won't cost you a thing. Just a one-on-one geared toward making you a healthier you. Now, write my number down. It's 309-693-3566. Give me a call and let's find out how to make every day a healthier day for you. Now, enjoy the interview.
Well, hello, it's Dr. Alan Weinstein here at the Weekly Health News Show, and today we have a very special guest, Dr. Carin Purtle. Good morning, Dr. Carin. How are you?
Good morning. Fantastic. How are you?
I'm doing great. We're excited that you're here. The listeners are excited that you're here. I'm going to take a minute and tell the listeners a little bit about you, and then we'll jump right into it. Sound good?
Good. Yes.
Everyone knows we travel all over the globe getting the top health care professionals on our show so that you, our listeners, could really learn what it is they bring to the table, incorporate that knowledge into your life and the life of your family so that you could really live a healthier life and your family could live a healthier life. And we started asking around, who could we get on the show that's a family wellness expert, treats a lot of kids, deals with a lot of families, really has an area of expertise that very few people really have. And Dr. Carin Purtle's name kept coming up, so we decided to give her a call and asked her if she'd take time out of her busy schedule and get on the show. And of course, she's been very gracious and is willing to do that. We're really excited that she's here. So hopefully we'll talk a little bit about wellness. We're really excited to do that. We're going to talk about really the family aspect of wellness and getting the whole family involved in a wellness program, how easy that really is to do. We'll talk a little bit about, hopefully, why children really need to be under care, why it's so important to start children at a very young age in a healthy direction so that they go on to become healthy adults and share that knowledge with their families. We're also going to talk about a technology she uses in her office that was originally endorsed by the NASA Foundation. We'll talk about that. It's an amazing technology. You have to hear about this. You're going to really want to know about this piece of equipment. And also one other thing I wanted to mention, because she and I talked about this a little bit. She does something special called low force adjusting. Maybe we'll have time to go into that also. Why don't we, Dr. Carin, really jump right into it, and let's talk about how you actually got started in the healthcare business.
Well, my first real experience was when I was in college. I started getting headaches, and they became more and more frequent to the point that I was getting them every day. I would take ibuprofen every day, several times throughout the day, just to sort of keep the headaches at bay, but they never really went away. And my mother was saying that, this isn't normal. You need to see a doctor about this. You shouldn't be taking ibuprofen every day. That's not healthy. But I've had some bad experience with medical doctors when I was very young, and I don't like to see doctors. So a cousin had mentioned that I should see a chiropractor. So I did, because I thought, well, they're not real doctors, so that would be okay. And I saw the chiropractor, went through the consultation and exam and everything. And at the end of it, after I came back to, hear what was wrong with me, they had said because I was in a car accident right before this, these headaches started. And, I thought, well, that's not possible because the car accident was just so minor that it just wasn't possible. And, we sort of went back and forth about that. And, the chiropractor had said, well, what is it that you don't understand? You didn't have headaches. You had this car accident, and then ever since then you started having headaches. So I thought, well, I guess he does have a point there. So he set up a treatment plan for me, and I stuck with it because, I started feeling better and better and better. By the time the treatment plan was over, I actually felt better than before I was even in the car accident. And I kind of thought, well, that's nice, but didn't really think much more on it. A couple of years later, in another car accident, then I knew, oh, I need to see the chiropractor. But it wasn't until a couple of years after that, even, that I started having some mid back pain. And I thought, I should see the chiropractor. But I, like many other people, thought, well, my insurance doesn't cover it. I'll have to pay, out of pocket for all of this. So I just sort of let it go and let it go until it got to the point that I couldn't internally rotate my arm. I couldn't move my arm the way I should be able to move my arm. And, this happened over the weekend. I ended up going to the emergency room because of it. And about 3 hours and $300 later, they said, well, we think it has something to do with the nerves in your back. So here's some Tylenol with codeine. Here's some drugs. Take this for 2 weeks. And if it doesn't go away, then you need to see a neurologist. And I looked at him and I said to him, aren't you going to like push on my back or something? Aren't you going to do something? Well, no, we don't do that here. That's what he had said. Here's this medication or whatever. So I was very upset about it, to say the least, and ended up taking the medication. This was a Saturday or a Sunday. Took it just to get a little bit of relief. Didn't really feel any better though. And Monday morning, when the chiropractor's office opened, I had called them immediately, told them the situation. They got me in right away. And, I talked to the chiropractor and about everything. And after one adjustment, I had complete full range of motion in my arm. And it was just like, it was amazing. And then, this light bulb sort of went off. I never realized before that the medical doctors didn't have the answers. They wanted me to take drugs for a couple of weeks. And then if it still wasn't better, then I needed to see another specialist. And yet I got right in with the chiropractor and had immediate relief, and not only relief of my pain, but I could actually go through the full range of motion with my arm again. And it was about this time in my life that I was actually looking to change careers. I wasn't satisfied with what I was doing. And I knew I wanted to do something where I really felt like I made a difference in the world, that I was able to help people. And it just sort of all fell together right at that time. And I decided to go to school to be a chiropractor.
Wow, amazing. You brought up a couple of very interesting points here. The first point you brought up, which I think is a hugely powerful point for our listeners, are something that your mom said. And your mom said, and I'm obviously not quoting here, but your mom said, it's not normal for people to have to take medication all the time not to get headaches. And there are so many listeners that are on this call right now, or might be listening to it in the replay on your interview, who think it is normal to take medications every day. And they every day wake up and they take their Tylenol or their Advil or their, ibuprofen, because they think, well, that's what I need to do. And they don't realize that there are alternatives to that kind of thought process, and you are a prime example of that. And then you also said something which I think is really really interesting, and that is that you at that time did not consider chiropractors real doctors, so you were willing to go. And there's a lot of people on this call that don't really appreciate the level of expertise, the level of education that chiropractors really bring to the table. And probably in this day and age now, and when we get to talk about a little bit about your technology that you use, that probably chiropractic is probably one of the only, or certainly a handful of few, totally professional, objective approaches to healthcare that no one really knows about. So that's really amazing. So let me ask you this question. You said the light bulb went on, you started realizing that, all of a sudden, you're feeling better after treatment than you even felt before you had your accident, forgetting that the headaches went away and your arm pain went away, your back pain, but you actually are feeling better. What is it about chiropractic, and what is it that chiropractors do that could make that change in somebody's life where they actually start to feel better than they ever felt before?
Chiropractors primarily work within the nervous system, and the nervous system controls everything in the body. You can't breathe without a properly functioning nervous system. You can't digest food. You don't sleep well. And as a chiropractor, what we do is we look for interference within the nervous system, and we call that a subluxation. And we remove that interference. And when the interference is removed, then the nervous system starts to function properly again, and we start to see these things, these symptoms improve. So headaches start to go away. A person's food starts to digest better. They have an easier time breathing. In fact, the most common thing that I hear is that people start sleeping better right away.
Yeah, fantastic. So let me ask you this question then. Now that you're practicing chiropractor, obviously, what kind of problems do you actually solve for the people that come to see you?
Well, as a chiropractor, again, we check for interference within the nervous system, and we correct or eliminate that interference through the chiropractic adjustment. And then the person's body starts to function at its highest level, at its normal level. So, we see a lot of problems resolve, headaches. I've had several cases with headaches. In fact, one patient that, she always comes to mind, she had two small children and she was just getting headaches all the time. In fact, they were so bad that she was taking medication for it, and she would still have to go in the bedroom, close all of the windows, pull the shades, and just lay down until the next day. She had been to, her medical doctor. She's actually been to several medical doctors because no one could find out what was wrong with her. She had had CT scans, MRIs. She had a couple of heart tests. She was on ibuprofen and blood pressure medication. She was taking Viax at the time, and still it wasn't helping. And periodically she would have to go in to the ER. Sometimes they would get so bad, and they would give her shots of Dilaudid. And, it got to the point where she was just taking Excedrin and muscle relaxers every day just to keep the pain at a minimum. And then she started coming in for chiropractic care, and the headaches started to go away. Now, this particular person, she would still get a headache every couple of weeks, but it was very mild. And, as long as she was getting regular chiropractic care, she didn't have any episodes like that, and how amazing it is, especially for a woman, a mother, to not have that time taken away from her family where she's, locked in her bedroom trying to just keep this headache from what it seemed like exploding out of her head. So, and headaches are just one of the things that we see in the office. We see people with allergies, we see people with asthma, we see people with ear infections, we see adults with ear infections and children with chronic ear infections. We see colicky babies, we see back pain. We see almost anything in the office, and we see it resolve because most of these issues are a consequence of an improperly functioning nervous system.
Yeah, very cool. If you just joined us, we're talking with Dr. Carin Purtle. Her phone number is 309-693-3566. Her website is www.purtlechiropractic.com. I want to switch gears here for a second. We've been talking about the nervous system, the function of the nervous system, all the potential things and problems it can cause Um, I wanted to switch gears and talk a little bit about the technology you use in your office. Why don't you tell the listeners a little bit about the technology, why you use it in the office, what it tells you, and what the benefit is to the patient?
Well, the technology that we use in the office is called the Insight Subluxation Station, and it has been used by NASA to evaluate the astronauts when they come back from space. And so we use it in the office to evaluate the nervous system of the patients that come into the office. And it helps us to, find out what truly is going on with patient's nervous system, how it's functioning, and it helps us to come up with a better course of treatment for these patients. And then we're able to reevaluate their nervous system to see how it's improving and how we need to alter, if you will, the treatment plans.
So this is actually, this machine is really just tells you the function of the nervous system. Would that be a correct statement?
Yes.
And how does it do that? What does it actually measure?
Well, it actually is measuring several different things. The one is we're getting some insight into how the nervous system is functioning as far as how the muscles are functioning. One of the components is surface EMG, and it actually evaluates how the muscles are functioning. It evaluates the action potential of the muscles. There's another component is a thermal scanner, and with that, we're evaluating how the autonomic portion of a person's nervous system is functioning. And then we use a heart rate variability monitor, which is just really cool. I That's my favorite part of the test, and it gives us an idea of a person's general adaptive potential. So how are they adapting to stress in their life? And we've all got stress. We've got family stress. We've got work stress. We've got chemical stress from the foods that we eat. And then there's, which everybody kind of knows about, physical stress. If you fall and, hurt yourself, or you're in a car accident or something like that. And that test helps us to evaluate, how a person adapts to that stress in their life.
So the nervous system then controls the muscles in the body, which is why you measure the muscles.
Yes, absolutely.
And the nervous system controls the temperature in the body, which is why you measure temperature.
Well, the thermal scan, yes, measures the temperature, which is controlled obviously by the nervous system. Yes.
And the nervous system also helps the body deal with stress.
Absolutely. I mean, you live your life through your nervous system.
So basically, you're saying everything and anything that keeps you alive, as I had said before, is really controlled through your nervous system.
Absolutely.
Now, this technology that you use in your office, is this something that you use on all the patients?
Yes.
Is it a painful test?
Oh, no, absolutely not. In fact, there is no, it's a non-invasive, it's just reading from the body. We put sensors on the body, and it's just reading from the body. I mean, it's really no different than those, as far as the invasiveness, than the thermometers that you would use to sort of swipe over your forehead and find out what your temperature is. That's not putting anything into your body. It's reading from your body. This is a lot more high tech than that, but it's the same sort of concept, that it's reading from your body. It's not actually putting anything into your body. So it's very, very safe and very effective. In fact, it's so safe that I use it on small children, and we're able to, see how their nervous system is functioning as well.
Now, you said something when you started talking about this, which was intriguing. You said they use this machine to test the nervous systems and the function of the astronauts when they came back from outer space. Now, that implied to me that there might be something wrong in the nervous system of these astronauts, but they may not have known that there was something wrong. Is that true?
Well, I mean, it's like any other disease process or problem in the body. I mean, most of the things that we have go wrong with us, we don't know it. That's why there's so many precautionary tests out there. That's why you go and get your cholesterol checked or your blood pressure checked, because we can have problems with the systems in the body, and yet we never experience pain or discomfort. And so we don't know these things are going on.
Why is that?
In your nervous system, pain actually, the pain sensory fibers only make up about 10% of your nervous system. In fact, we've all heard stories of a person that is, considered healthy one day and drops dead of a heart attack the next day. They had no idea that anything was going on. And as far as cancer, for instance, that takes years to develop. The person still has it going on, but they don't know it until it's years into the disease process. And with this subluxation station, we're trying to identify problems within the nervous system earlier rather than later, so we have more of an opportunity to make a correction.
So are you saying that someone could come into your office, you could do this scan that's not painful, non-invasive, and literally find out if there's something wrong in a part of their nervous system that they may have no clue about yet at all because they have no symptom?
Yes. Mm-hmm.
Now, let me ask you this question. Is there any other way to know that? I mean, is there any other test that you could do, or is this really the only way that someone could really find out the state of their nervous system?
To my knowledge, there isn't any other test, and this is, yes, the only way to find out.
Now, wouldn't you think that anyone listening to this call would want to get that test done? In other words, they might be walking around with a heart issue. They might be walking around with a problem that has no symptom whatsoever and literally not know it. And they can have a test in your office that's not painful, not invasive, and try to find out, yes?
Absolutely.
So do you tell everyone they need to have this test?
I do, yes.
Yeah, I totally get it. If you're listening or you just joined us, we're talking with Dr. Carin Purtle. Her phone number is 309-693-3566. Her website, www.purtlechiropractic.com. She's just been telling us about a technology she uses in her office that literally allows her to determine the function of your nervous system and find out if there's an underlying problem even before you have a symptom or even know what's going on. This is like a crucial test that you need to get in and really get into her office and get this test done, it sounds like to me. Let me ask you a question. I know you're a family wellness expert. You still deal with people with acute problems and chronic problems also, yes?
Well, and that's what brings a lot of people into the office is that they have a low back pain or a neck pain or something like that. But once they get into the office and we can perform these tests on them and find out what exactly is going on, they start to understand that, there's really more going on than just neck pain or back pain generally.
Yeah, that's really a great point, actually. I was wondering, and I was going to ask this question. You actually answered it before I asked it, and that was, I'll ask it anyway because I'm curious. Do you find that now people are more proactive? They'll call you up and say, Dr. Carin, we heard about the great work you do with family wellness, and rather than wait for us to have a symptom or a problem, we'd like to become proactive and get involved in one of your wellness programs so that they can not wait, as I said, until there's a problem. But it sounds to me, and correct me if I'm wrong, it's still symptoms that drive people into the office. And then once you educate them, they get to see the value of the nervous system. That's when the light goes on for them, that they realize, wow, there's really something else going on here.
Yes. Mm-hmm.
Yeah. Do you find also that once they learn that light bulb goes on, do you find that it becomes a family affair? In other words, the wife might come in, they learn about the value of having a functioning nervous system that's functioning 100%, and they want to bring the kids in, and then possibly they could drag their husband by his hair and maybe get him in, since men are so much more difficult. But do you find, I'm kidding, but it's true. I'm kidding, but it is true. Men are the worst. That it's so hard to get men to come in. But what do you find? It does become a family affair?
Yes, definitely.
And is it something that's fairly easy for the family to incorporate into their lifestyle?
Yes, I mean, we try to set it up in this office that it is, relatively quick as far as time goes. A person, you know, some people have the idea that you go into a doctor's office and you wait around for hours and things like that, and that certainly is true with some doctors' offices. But we realize that people are pressed for time, and we really try to be on time with our schedule so that a person or a family can come in and they can get the adjustment and then they can get on with their day as quickly as possible.
Cool. A couple of other questions. We are starting to run out of time, so I have a couple of other questions that I want to get to. Let's try to get these done, as quickly as possible before my producer, shoots me, or before my producer subluxates me, and then I have to come in to get treated. Number one is I want to talk about low force adjusting briefly, because I know some people are like, ooh, I don't want my neck cracked or those kind of things when they think of chiropractors. Talk about what low force adjusting is for a minute, if you don't mind.
Well, low force adjusting is simply that. It's a lot lower force than some of the adjusting techniques out there. And I've actually had several patients referred into the office. They, wanted to be under chiropractic care. They had understood the value of chiropractic care, but chiropractors that they had gone to in the past, they just didn't like that high force, all of that popping and cracking. And I use a couple of different instruments in the office that are, just like a light tapping, if you will. And that in the beginning is a concern for parents as far as their children being adjusted. They don't like the idea of their children having this sort of very forceful adjustment, and the techniques that I use, it's just so light and minimal. It's like checking a tomato to see if it's ripe. It's very little pressure.
And you use that with adults also, yes?
Yes, absolutely. I do have some adults that prefer that. I do some manual, some adjusting by hand as well, but I use the instruments too.
Cool. Next question. I'm sorry, to sort of condense all this, but we only have a limited amount of time, and I'm more than happy to get you back on the show. But I want to make sure we get all this out before. Let's talk about 2 seconds worth, 2 minutes worth, of course. Why would children need to come into an office to be treated?
Have you ever seen a child start to walk? They're falling all of the time, which is causing, a jarring force on their spine, which is affecting their nervous system. Kids are dealing with trauma all the time. My daughter is 4 and she's got bruises on her legs all the time from tripping over this, falling over that. And not to mention the birth process. Have you ever, seen that in action, the way they sort of twist and pull on the head? It's hard to get through birth without having a subluxation, without having, this trauma to your nervous system. And as they develop, they're going through these growth spurts, and all of these things are causing stress to their nervous system.
Yeah, one of the things we talked about before, which I think is really worth mentioning here again, is just as we said before, when you see these kids in the office, they may have no symptoms because only a small percentage of the nervous system is really for symptoms, but they may have functional problems. Is it possible those things will manifest itself as the child is going, getting into school and things, that it might turn out to be a nervous system problem as far as attention deficit disorders or other learning disabilities, being undetected interferences to the nervous system from the birth process or from these falls that you were talking about, that unless these kids are checked, it will develop later on.
Absolutely. In fact, one of the leading medical professionals with ADHD is now really recommending chiropractic care along with some lifestyle changes and avoiding some of the medications that are being prescribed to these children, because it isn't due to the fact that they don't have enough medication in their lives. It's to the fact that their nervous system is just so overwhelmed, and that's how it manifests itself in these particular children.
Yeah, I think, we see that now, these shows like Good Morning America or Today or whatever those shows are, we're starting to see more and more people come on and talk about chiropractic in the environment of dealing with learning disabilities, getting amazing results. I think that's almost commonplace now that people are starting to realize that's true. As I said, we're just about running out of time, so I wanted to thank you for taking time out of your busy schedule and coming on the show.
Well, I'm happy to be here.
Well, it's really totally our pleasure. We've been talking with Dr. Carin Purtle. Her phone number is 309-693-3566. Her website is www.purtlechiropractic.com. I want to stress to our listeners, make sure you get in touch with Dr. Carin and find out about coming into her office with the entire family, getting that test done, find out the function of your nervous system, especially the kids, because you don't really know if they have a problem. You don't know if you have a problem, let alone if they have a problem. It's really worth doing, so I want to really bestow upon everyone to do that. Second thing is just a yes or no answer, because I really need to go. Do you ever go out in the community and talk about health and wellness in businesses, in schools, churches, groups, that kind of stuff?
Oh, definitely.
Cool. If you do have a business or a club or church group that you really want a true expert to come in there, talk about wellness, can you take that technology with you to those lectures and do some of the testing there?
Some scans, yes.
Fantastic. So talk to Dr. Carin. Make sure you call her at 309-693-3566. Make sure you get her into your place of business or your club or your church or library so she can share that information with you. This is Dr. Allen for the Weekly Health News Show. I'll be back next week with one more health expert to help you take charge of your health.